Hello everyone, this is Dr. Umahani Khan, and today we are going to discuss a fascinating observation about carcinosin. When I first studied the carcinosin personality in the materia medica, I expected to see exactly the same picture in my patients, but what I observed in real clinical practice completely surprised me. Over the years I realized that the personality many people present to the world is not always the same as what is happening internally. In several cases I found that the saintly image the patient projected was often a carefully maintained mask, while the inner emotional reality was entirely different. One patient in particular left a deep impression on me. She suffered from severe acne, and I studied her for almost 4 years. Outwardly she appeared extremely religious, gentle, soft-spoken and disciplined. She fasted throughout the year despite long journeys and physical hardship, and everyone admired her devotion. However, as I explored her case in greater depth, a different pattern gradually emerged. I observed repeated manipulative behavior where she would use her appearance and charm to influence the person responsible for attendance records and later convince him to mark her present even on days she had not signed in. I noticed similar patterns where personal gain and rapid success seemed to take priority over honesty and fairness. This contrast between the outward image and the hidden inner state reminded me of the very nature of cancer itself. In many patients, cancer remains silent for a long time, with intense pathology developing internally while very little is visible externally. When people hear the diagnosis of cancer, they experience humility, compassion, and sorrow because the disease has already progressed beneath the surface. In some of my carcinosin cases, I observed a similar symbolic pattern where the external presentation appeared calm, perfect, and socially admirable, while the internal emotional conflicts remained concealed. I also noticed a strong attachment to personal image, beauty recognition, and the desire for rapid success, accompanied by behaviors that compromised integrity, like cheating for selfish reasons, gaslighting, shaming others. Since then I have prescribed it in multiple carefully selected cases, and the recurring pattern I have shared today became one of the central themes I personally observed in my practice. If you want to understand remedies beyond memorizing textbook descriptions and wish to learn how to connect psychology, pathology, and clinical observation into one complete picture, then join me on this journey of homeopathy. Stay loyal to your system of medicine instead of abandoning it after BHMS to practice allopathy, perform routine paperwork, or spend your career doing work that never fulfills your passion. Master your own science, trust the principles of homeopathy, and become the kind of homeopath your patients will always remember. All the very best, take care, and I will see you in the next study session.
सर पे ये झूठ की दस्तार रहेगी कब तक? सर पे ये झूठ की दस्तार रहेगी कब तक? ये बता, ये रेत की दीवार रहेगी कब तक? हमने फिरौन को, सद्दात को मरते देखा है, देखते हैं तेरी सरकार रहेगी कब तक?
So you look at this man, I'll give you a lesson. He's the most beautiful looking man. He looks so nice, he's like an angel. But actually, he's as tough as he's a killer. I don't want to, he's a killer.